photo to tell if there's edema. That's why the OCT is nice, because the OCT will show you the thickened retina. But you have some leaking blood vessels, and so you usually get exudates kind of in a ring around where it's leaking. Same here. This is also a nice photo that we looked at before that shows what the heart exudates look like in the OCT. Conical spots are going to be fluffy white things. So this is like, if it's white with diabetic retinopathy, usually either a conical spot, which can go along with the fibers of the retinal nerve fiber layer, whereas a heart exudate is more sharp border, not fluffy. So just a combo of some flame hemorrhages. Again, those are in the retinal nerve fiber layer. They're going to go along the axis or along the direction of the nerve fibers, and then more of a fluffy white spot, the conical spot. These are very difficult to see, but if you see tiny, tiny little blood vessels that are coming out that are aberrant, these can be intraretinal microvascular abnormality. I think in practice, these are hard to see. And then finally, looking at neovascularization of the disc, and neovascularization here, maybe some ERMA along hemorrhages. Yeah, so like here, NVE, neovascularization elsewhere, and NVD on the disc. Preretinal hemorrhage, you get a nice bone-shaped hemorrhage because of the vitreoretinal interface, and then you can get a diffuse hemorrhage as well. And then macular edema, like we said, it can be hard to tell thickening. All you can really see on the photo is the exudates. But if you do see exudate, probably we are going to get both OCT and the photo, so it should be easy for you to tell. But if you see this, I would call that macular edema. I don't think in our app it just says macular edema yes no. I think so. You don't have to really worry about this about the stages. Okay, maybe we can. Well, maybe I'll just finish this. So you can look also at the cup to disc ratio, the vertical cup to disc ratio on the photo, and on the camera you can show them how you can zoom in to see it in more detail. I think everyone knows, how to do a cup to disc ratio, but we're looking at the vertical cup to disc ratio. Yeah, the other things to look for along in the optic nerve are for hemorrhages and for a notch, if there looks like there's a focal rim thinning, and then a retinal nerve fiber layer defect. So for example, you can see like a little hemorrhage right here. This, we can see a large cup to disc ratio. I guess that's supposed to be showing a notch, although I'm not really seeing it very well. Yeah. Again, look for, when you're looking for the cup to disc ratio, looking for the contour of the blood vessels is the easiest thing. Oftentimes our eye wants to use the color, but the color sometimes is not the best. The better thing to use is to look where the blood vessels are. So like this one, is very extreme. Cupping the blood vessel, sort of like there's no rim at all really. It just comes right out of the disc. Asymmetry. So that would be another warning sign for glaucoma if there's asymmetric cup to disc ratio in the right eye versus the left eye. This is a nice example of a retinal nerve fiber layer defect. You can see how it's like a darkening of the retinal nerve fiber layer in this one area, and that should correspond to a notch in the optic nerve. And then finally, looking at some photos of macular degeneration. So probably you should be able to see drusen pretty easily. These are drusen in the macula. We can look at the size of the drusen. There's like small, intermediate, and large drusen. How can you tell the difference between intermediate and large?
If you we can compare it with the adjacent blood vessels. If it is whether the drusen is larger than blood vessels or smaller than blood vessels or is equal to blood vessels.
Yeah, and look, that's exactly right. And you can kind of look at the thickness as a general rule, the thickness of where the blood vessel comes out at the optic nerve. Use that, and if it's bigger than that, it's large, and if it's smaller than that, then it's intermediate. So here's an example of geographic atrophy, where you can see the underlying choroidal vessels. Those squiggly lines are the underlying choroidal vessels, but this is a huge area of atrophy right in the fovea, whereas here is drusen. These are deposits under the RPE. This is a subretinal hemorrhage. You can tell it's subretinal because this blood vessel is going over it, right? So there's retina over it. And if you see subretinal hemorrhage, here we don't see really any drusen, but if you see subretinal hemorrhage, that should make you worry about a choroidal neovascularization. Macular scar, just kind of, this looks almost like PVR it might be starting, proliferative vitreoretinopathy. Epiretinal membrane. On the photo, you see striae. You can see the pulling of the epiretinal membrane on the retina. Okay, so now we can go back if you want to come back up there.